getting into any career path, the very important question is how does a typical salary range look like? So can you please shed some light on this?
Because we are imagining a future where a patient comes with an entire AI driven profile where you can exactly then know what to intervene and what has happened, right? Based on history, culminating all the data points that they have. I received a lot of guidance in my early days, and that has shaped me to where I am today. And I don't think it had been possible without my mentors to even enter into MD Pharmac and then get into all these roles and then get into these kind of careers that I have today. Because healthcare cannot happen without doctors. And healthcare is not just hospital. So it is wide. There is a lot of scope and demand, and people can and take multiple opportunities. And and how more and more people enter into this domain, this will also evolve and become more organized and structured for doctors. See, today you have these handful of people in different places, and it's not structured, right? But if more people enter into these domains, it's going to get structured in the way.
In your view, how is AI transforming healthcare, especially in terms of patient engagement and adherence? And how do you foresee as the next big step in this space?
I think AI is transforming various aspects of healthcare, right from screening to early diagnosis to administrative tasks to outreach, from a digital perspective, telemedicine, uh, report reading, AI scribes, to supporting clinical workflows, giving you diagnoses, giving you, judgments on what these differentials could look like, what treatment paths can you follow, to agents that help you do empathetic conversations with patients as well. So it's transforming, I think, the landscape. Coming to patient engagement adherence, I think there's a lot that AI can do here, because just the way smartphones and all these messengers and all have been integrated into our day-to-day life. Right? You are in Philippines, I'm here, and we are talking. It's that integration of technology that helps us do all of these things, which weren't imaginable a couple of years ago. So similarly, AI, enters the space, and you're going to have things which are not imaginable in a couple of years, right? So you'll probably see a patient with a through and through profile. If you have seen sci-fi movies earlier, where like have a robotic eye or a lens which tells you everything. Like for Iron Man fans, like Jarvis, which tells you everything. The code tells you everything about the person, the depth, how you want to do things. Similarly in healthcare, I look at the patient and I know everything. Risk profile, risk factors, okay, this history, genetic profile, pharmacogenomics, this therapy will work, behavior patterns. This is how the patient does. That is, I think, lacking. And that, I think, again, can be filled with particularly the interventions, the kind of things we're building at Iksa, etc., where you understand patient adherence, you get their behavior patterns, know what works for them, what ticks for them. And that fits into that whole puzzle, because we are imagining a future where a patient comes with an entire AI driven profile where you can exactly then know what to intervene and what has happened, right? Based on history, culminating all the data points that they have throughout their healthcare lifespan. Like when I'm looking at you, I know everything. I know all your risk parameters. I know whatever information is needed for me to come to a diagnosis, and what therapies will work for you, what will not work for you, to the extent of knowing, oh, okay, he doesn't take his medications on time. So let me see if I can give him something which is only once a day, or he doesn't come for follow-ups often. So let me prescribe for 6 months instead of 3 months. So those kind of things. What we are building on, helping patients get better outcomes by adhering to their medication, understanding questions around it, having better doctor-patient relationship and communication beyond the clinic, because 90% of healthcare is outside the clinic. The clinic is only a cross-sectional view. For a few minutes is where that interaction happens, but the rest, everything about health is managed outside. So, trying to bridge that health gap, that if it's managed outside, it really needs to bridge that gap of in clinic to out clinic. And that's where I think AI has tremendous potential because it is gradually getting integrated into our day-to-day lives for many things. And that's how it will feed into healthcare as well.
All right, so thank you so much for all the wonderful insights about the career. Now we will be moving next to our segment that is your career path and experiences. So the very first experience I want to uh, brief you over about your IIM Ahmedabad experience. How did you attend the summer school on advanced research method at IIM Ahmedabad? Influence and how did it influence your career decision?
Uh, it was very interesting. I was at a DI event in Bombay, and there was a gentleman sitting next to me, and we just started talking. And he was also an anesthetist, and I think he was working in the pharmacovigilance domain. And he mentioned to me just passingly about this, and he said, I think I missed the last date, and this was an interesting thing to be in. And I just picked up my phone, looked at it, saying, what this is. And he said, actually, the conversation happened because there we spoke about, me going and presenting at the DIA on a pharmacoeconomic paper. And he was asking me about other research projects of mine. And I had one of the research papers on statistics in medicine. And he said, there is this summer school where they're also looking at people who've done something in this, and if you are going to present it, you get a chance to present it there and then learn at IIM for a week. And but he said the last date is gone, so probably next year. And I just out of curiosity, googled it, saw what it is like, and realized that they're still accepting, and wrote to the professor saying, I'm keen and whether I should try, and this is my paper, and they know this is really nice, and we will let you present this paper here, and you can be a part of this summer school. What it changed, I think, for me was a lot of learning the way IIMA teaches, the way it stimulates your mind in terms of learning, meeting a lot of interesting people who've done many, many interesting things, in their student careers, in their post graduation, in their PhDs, etc. And again, helped me broaden that horizon. That again, the world is much bigger, and there's a lot that you can do, and there's a lot to learn to get those things. I think it has helped me in understanding the way I learn things, the way I teach things, and also, of course, a lot of very good concepts and great exposure in many, many ways.
All right, sir. So the next I want to ask about from freelancing to leadership. You have held diverse roles from a freelance medical content writer to program head at Fitterfly. How did these experiences shape your leadership style and vision for healthcare innovation?
I think every role and every stepping stone is very, very important uh, to do it. Leadership again is not very title driven. I think leadership without authority, leadership without title is the way to go, because it should more of it should be a mindset. I think so. Those are it's mindset, and then there are certain skills which you have, certain skills which you develop and groom over time. um, it's about also taking every experience that you get in that role and preparing yourself for the next one. So I've luckily had a lot of career mentors who've always guided me on two things. One is the breadth of your career, the breadth of your role and influence. So it's not about uh, being in one position only, but seeing how you can influence uh, in being in that role. How many people you are impacting within the organization, how many people you're able to influence and lead without having a title or without being a head. That's the breadth of your role. So I think that's something people should work on. You should, and at every juncture, I think a lot of times I've had this. It took me a long time to learn how to say no to things, but early on in your career, I think saying yes to a lot of opportunities sometimes just helps you. Taking them up and then seeing how it will shape you and what you learned out of it. I think nothing goes waste. every project, everything that you do in the role will shape something or the other in your career. So one is that. Two is also looking at aspirational roles. So which is when you want to aspire to be something else, you see what their job description is like, what they do if they are within your organization, or if you have the opportunity to actually see how they work or what they do. So one of my mentors told me, like, you should just see how they talk, how they answer questions, how they do this. Because if you want to be that, then you need to know that. So if I want to be on a podcast and talk about it, I would have had to see a couple of them and see how experts actually talk on things like these. Then of course you have your own flavor. Everybody has their own individuality, but I think it's about learning. So if you learn in every role, you grow. And I have never let titles define me, and I don't think it should define anyone. I understand it's a human tendency to love having that head and lead and director on your title and your visiting card, but that will not make you a leader. I mean, you can be a head, you can be a lead, but you may not be a leader in the true sense. I think they sometimes are very different things.
All right, so thank you so much for putting this beautifully. The next question I want to ask you, sir, you are a passionate mentor, as you mentioned already. What drives you to be a mentor, and what's the most fulfilling part of guiding others in their careers? And what are the queries that you get the most?
Uh, I think, of course, the very philosophical answer of mentorship is to give back. But for me, it's more about I received a lot of guidance in my early days, and that has shaped me to where I am today. And I don't think it had been possible without my mentors to even enter into MD Pharmac and then get into all these roles and then get into these kind of careers that I have today. And I feel sometimes, everybody needs support. People, particularly the younger lot, needs, and they don't know where to go. I think I was lucky that I could find the right mentors. But uh, even though the world is very large today, sometimes they don't know whom to ask for, what to ask, and who will give them honest answers or not. So when somebody has taken unconventional paths and treaded, gone through the grind, the rigor there that way, I think it's good for me to say, stand from there and tell you when you're trying to take that detour that hey, what these are the 10 things that will come your way if you want to come to where I am today. So it's good to tell people and make them aware. So a lot of my mentorship, I think, is about spreading awareness. The kind of questions that I get, of course, from people are very similar to what you ask in terms of career paths, etc. A lot of times, people want very direct answers, very much on the platter, which is sometimes I feel not right. You're not going to get those kind of answers. You can't really clone my journey into yours or clone somebody else's journey or presume that this was their path. So like, okay, this person became a director in 5 years, so I can also become. I'm even more intelligent. I can become in 3 years. Or I want to start earning so much right from the beginning, etc. So I think those are some things that come up in questions, in conversations, in that. But yeah, most rewarding and fulfilling for me is if it changes perspective for people. I think I only end most of my conversations with food for thought. I'm there to guide and advise people, but it's mostly food for thought. You have to figure out a lot of things your way. I cannot draw your life path, your career path on a platter and give it to you. Like, okay, this is what you have to do, and this is how it will work. It doesn't happen that way. So, what's fulfilling is if I can change some perspective, can have uh, people venture into different spaces and be happy in their career. That's, I think, what I see.
All right, sir. Thank you so much for this insights. Sir, also I want to add up on this that when we go into the traditional medicine, so it is very streamlined procedure, getting into MBBS, getting into residency, then start doing SRship and getting into the hospital or setting up our own clinic. So this has been a streamline, and this is with having this a streamlined procedure. So we usually have the tendency to get spoon fed. So when we switch to such unconventional paths, so sometimes has to identify that this is not the path where you will be spoon fed everything. You have to figure out yourself. So thank you so much for putting this wonderfully. So the next question I want to ask you, how do you see Medicos transitioning into non-clinical careers? And do you think there is a demand of medical doctors in this field?
think the demand is always there in terms of either industry roles, in terms of digital health tech, in terms of AI, in terms of startups, entrepreneurs. I think everywhere, because healthcare cannot happen without doctors, and healthcare is not just hospital. So it is wide. There is a lot of scope and demand, and people can and take multiple opportunities. And and how more and more people enter into this domain, this will also evolve and become more organized and structured for doctors. See, today you have these handful of people in different places, and it's not structured, right? I But if more people enter into these domains, it's going to get structured. In the West, I think there are a lot of organizations that people have developed where you have people transitioning from clinical roles to non-clinical. I had somebody who was doing a coders event for doctors, like doctors who've become coders in the US. So people are transitioning, and transition, I think, can happen in many ways. You can either do it as a side hustle, you can do it as a full-time thing. It's up to you how and you want your career to be shaped. Opportunities will always be there for the right people and with the right skill set. You cannot take opportunity for granted. That okay, I'm a doctor, we are doing healthcare, something, so they will need me. It's also about the insights that you can give. You cannot force fit your day-to-day practice into this. You're solving a larger problem. So what happens sometimes, with doctors is we are so close to the tree that we miss the view of the forest. We are only so close to like doctor patient, doctor patient. We don't see, how these things can impact it on scale. You are trying to solve for your individual practice problem. You're trying to solve for an individual problem. And then if you force fit those as these are my insights for the industry and for you to solve a problem, I don't think people are going to appreciate it. So I think this is one thing that doctors need to be very wary about. And since, this is a platform where you talk very openly about challenges and all these elements, I think this is one key thing that we should learn as doctors. We are so used to imposing, "Ha, ye dawai le lo 3 mahina." This is our approach. So we think this is the approach everywhere. So if you're transitioning into any non-conventional path, please forget this approach. This is what my first mentor in MD Pharmacology told me, like somebody who was very instrumental in pushing me that okay, you should take it. It's good in this way. And he said, just leave this mindset that whatever I say will happen. This is what doctors are trained to do. That I say it will happen. So that's not how it works. And it is not individually then. If you're looking at scale, if you're looking at larger things, organizations, thousands of patients you want to impact or build a business, you have to have things which flow into that thing. Your acumen has to develop those skills and insights to feed into that business. I cannot say, for example, if I'm doing something on patient engagement and adherence, I can, but my grandfather takes medications every day. I have patients who don't complain that they forget their medicine. So you should not do this. So it doesn't work that way, right? You may be an oncologist and maybe your patients will obviously take their chemo. They will not forget it. So you don't know. You have to build whatever you're thinking. You have to have a bit broader horizon and take a step back. So when you transition, please think of all these things that you have to be insightful in the right way and not talk about your personal problems, so to say.
All right, so thank you so much for this insights. As you mentioned about this having right skill set, so can you mention what are the skill needed to transition in such careers?
I think the biggest skill, the hardest skill is the soft skill. Soft skills are very key about how you communicate, how you articulate your verbal, non-verbal, your written. communication, your presentation, your even one-on-one conversations with people, I think you have to work really well on your soft skills. Uh, Two is staying updated, like knowing so that you really know what's happening in the space. Helps you to do some conversations. You need to develop networking skills as well, and again, understanding perspectives. I think that is the biggest skill. Understanding where every stakeholder comes from, where a marketing person comes from, what a sales person comes from, where an access person comes from. You have to have that mindset to understand where everybody is coming from. Those are, I think, key skills. Learning on the go. I'm not a very big fan of formal curricula based courses, etc. all the time. A lot of it happens on the job. Good to do, but again, don't do with the intention that I've done a Coursera and I will get a job because I've done Coursera on AI in healthcare, so somebody will hire me. It's also one is those skills, and two is also the attitude to learn and adapt and see how you want to also the hustler attitude as well. So if you have those skills, I think it'll work. There is no I cannot give you a fixed skill set that okay, these are 5 things you need to know. These are like the broad things you need to do, and within these, of course, then you will have eventually a lot of learnings on the job.
All right, sir. Thank you so much for this insight. So, sir, when you are doing your traditional MD pharmacology, so how did you landed to your first job or internship in this unconventional path? How was the journey? Can you brief us over at that?
So for me, I think it was quite easy, but I was placed much earlier than my bond got completed, and it was through one of the seniors who had actually heard me at multiple conferences and presented and all, and there was a vacancy in his team, and he reached out to me. So it worked that way. Entry level opportunities are multiple, I think, for people looking into it. Mostly, you apply either through your network, through your seniors, through your contacts, or of course there are sources like job portals where again you people will find you and you can get those jobs. So uh, job hunting, there's no, of course, no placement or anything like that, but it's more or less based again on your network and your skills, aspiration, and who you want to reach out to. But I think there isn't an issue with entry level jobs. I have not hardly seen anybody struggling to find a job.
All right, sir. So, can you mention what are the best companies to work after getting into this unconventional path?
Uh, I don't think labeling any company as the best company or will work. I have limited experience of working in 3 companies and now co-founding another one. So I think my experience is very limited to 4 companies in the world to really give an opinion. My journey has been great at all the 4 places. May not be the same for many others. So I think look at the work culture, look at the kind of people that are there, look at the kind of work they are doing. Speak to a few people from that company, and you will know whether it's right or wrong. We can take certain caution about knowing in advance that what a company is or what the people there are like. Sometimes job decisions are not always going to pan out that exact way. Your manager may change, the management may change, something in your role may suddenly change. So you can't predefine and predecide a lot of things. Sometimes you know it's not a great company, but you need the job. So, uh, I think you can have certain checks in mind, like what are red flags, green flags, like you probably do in every relationship. But yeah, it's just like a relationship. It may work out for you, it may not work.
All right, sir. Thank you so much for this insight. Sir, while considering,
Uh, I wouldn't know, how a lot of people salaries in corporate are generally asked to be kept private for most people. So you wouldn't know what others are earning or how much the growth has been for large number of people. From this is solely based on what my mentees and people who reach out to me for guidance on jobs and interviews tell me. Typically, it's somewhere between I think 15 to 18 lakhs per annum for people passing out of MD Pharmac. Uh, for now, I don't know how much has that changed, but I think this is like the ballpark range that I knew from the last hiring season.
All right,
But
sir.
yeah, your see things are exponential sometimes. Sometimes you may be stuck at a given salary. So it's about how you navigate it, right? Sometimes you have friends in clinical who are struggling to find 5 patients a day, but you feel because they have a very fancy looking clinic, they are earning much more. So, same is with these things. Sometimes people feel salaries or corporate wearing fancy suits and going everywhere. Maybe you're earning a lot. So depends a lot. Many factors for salary, which will change and evolve over time. But I think this is like a broad entry level that a lot of people get into.
All right, so thank you so much for shedding light on this. Sir, what are the special courses or certificate that you did or you think are necessary to do or good to have to get into this field?
I don't think there are any courses which are necessary beyond your traditional degree for getting into the field. For your own learning, n number of courses are available. LinkedIn Learning, Coursera, Udemy. Take up whatever you can and learn and do things. Uh, but don't do it with any intention that this course is going to propel me in my career in terms of getting a job faster or getting few lakhs more in salary, etc. So that's not the intention of these courses. But do them for self-learning. I think you can do self-learning from various things on how to write an email to how to conduct a meeting or how to have an online presence to building visibility in corporate world to understanding AI for dummies, to understanding digital world, anything. Just I think take it up as learning as a hobby maybe and do it. But I don't think there are any courses or certificates necessary to get a job.
All right, sir. Sir, do you think is there a need of coding to get into this?
I think there is a lot of AI coding that happens without coding. So, see, one is about technical skills. If you are interested in it, like you want to be, I recently, I think, had a call with a mentee who is like, I want to build a product. I'm a doctor, but I want to build a product. I said, learn coding. Because if you want to build something, you are passionate about it. Like, I want to do coding. Like I was telling you about this conference of, medical coders who are doctors in the US. So, if you're passionate about it, do it. You don't need to learn that skill because you're not going to probably code as well as a coder will, right? I mean, you are there for the medical insights in it or different domains in it, but if you feel you want to get into coding, you can get into it. It's not a necessity. It's about if you like doing it, you can do it. But if you're doing it for a job because I want to get that job, then I will hire an engineer who's a coder. Why will I hire a doctor who's
Exactly. So moving to the next segment, that is AI in healthcare specific question. So, sir, what do you think the role of AI in healthcare?